Question number 1. A client has died and the nurse asks the family members about the funeral arrangement. The family member refuses to discuss this issue, which is the appropriate nursing action. When anybody die in the hospital, definitely we will talk to the family. Because family members supposed to be the first stage of grief, and the nurse should remain with the family member. This is the system. So first of all, refuses to discuss what are the appropriate nursing action. So what is action? Show the acceptance of feelings, provide the information needed for decision making, and number 3, suggest a referral to a mental health professional, and number 4, remain with the family member without discussing about the funeral arrangement. So when we work for a patient for a long time, a good relationship will make with the patient and the families, right? So you have to participate, whatever, if anything, about the family decision. So the best or appropriate action supposed to remain with the family member without discussing about this issue. What is the explanation? They said the family member is exhibiting the first stage of grief, and also the nurse should remain with the family members. They said option number 1 means show the acceptance is an appropriate intervention for acceptance or reorganization and also restitution states. Option 2 means provide information needed for decision making. Option 2 may be appropriate intervention for bargaining out states. Number stage 3, referral to the mental or health profession. Number 3 may be appropriate intervention for depression. So what next? Next question here, select all. So nurse is assist to perform a focus data collection process on a client who is complaining of symptoms of cold, cough, and lung condition. Which should the nurse include for this type of data collection? Our patient complain about the symptom of cough, cold, and lung congestion. So which should the nurse include for this type of data collection? Select all. So listening the lung sound. So during the examination of the patient, we put the stethoscope over the lungs and we will evaluate if any added sound, resonance or dull, all area is equal or symmetry or asymmetry. Definitely it is the trace, is the data. And also obtaining the client temperature. This is the answer because patient cold, have condition, maybe because of infection. Temperature is important to measure. This is the data. So patient complaint, subjective data. When we measure or examine, we will get objective data. Checking the strength of peripheral pulses. So patient complain about respiratory problem, we will be focused. Already examiner has performed focused data collection. So peripheral pulses not to the focus of this. Peripheral vascular disease, atherosclerosis, diabetic, it is important, not for this. Obtaining information about the client respiration, yes, because this is focused data regarding to the cough, lung congestion. So if respiration is not okay, it would be included. Perform musculoskeletal neurological examination. Definitely no. We are talking about the respiratory system only. Number 6, ask the client about a family history of any illness or disease. Definitely number 6 is a good option, but not for this question. Because of this keyword first. So we choose number 1, 2, and 4. So what is the rationale? A focused data collection proceed in centered around a limited or short-term problem, such as the client complaint, because the client is complaining of symptoms of cold, cough, lung congestion. The nurse should focus on the respiratory system and presence of an infection. A complete data collection includes a complete health history and physical examination, and from a baseline and checking the strength of pulses related to the vascular assessment, which is not related to the client complaint and nothing related to the lungs. A musculoskeletal or neurological examination also is not related to the client's complaint. However, related to the client's complaint, however, the strength of peripheral pulses and a musculoskeletal neurological examination would be included in a complete data collection. But next here, the question asks, the nurses note that a 6 years old client and client doesn't recognize the client with a diagnosis with asthma and admitted to the hospital with a respiratory distress. Which sign should the nurse expect to note in the health record when collecting data related to the respiratory system for this client? So again, I'm saying that if patient have asthma admitted to hospital with a respiratory distress, which ensured the nurse expected the health record which collecting data related to the respiratory system. Number one, stridor and cyanotic lips diminished the breath sound or and fever, wheezing and use of accessory muscle, and pruritic friction, and inspirational chest pain. If you read the question, examiner make it easy because diagnosis is asthma. For the asthma patient, which one is most accurate? Definitely number three, wheezing. An asthma patient has a struggle for the air. Their accessory muscle participate with respiration and expiration. Why we choose number three? What are the rationale? Asthma is a respiratory disorder characterized by recurrent episode of dyspnea, also constriction of bronchi, wheezing. Wheezing are described as a high-pitched musical sound we heard when all passes through a obstruct or narrowing the lumen. The client with respiratory distress use other chest muscle to breathe. Muscle restriction is observed at the sternum and between the ribs. Some note, stridor is a stridor is a crowding, and it is more common the upper ear obstruction or often signal to the life-threatening emergencies. Cyanosis is blue discoloration of the lips occur as a result of poor oxygenation of the circulating blood. So if our blood do not get enough oxygen, blue discoloration occurs. Carbon dioxide is increased. We call cyanosis. Diminish the lung sound are heard over the lungs tissue where poor oxygen exhale is occurred. What next? Select all. So the nurse is reviewing the client health record, and note that the client elicited a positive Romberg sign. Based on these findings, the nurse should institute which intervention? Select all. Collecting data to determine factor for fall risks. It is choose the blind, close the blinds, and turn off the overhead light. Instruct the client to ask for assistance when getting up to work. Instruct the client to ask the assistance and teach the client to left leg high while walking and ensure the client is upright when eating or swallowing. So our options choose number 1 and number 3. Why? Why we choose it? They said in the Romberg test, the client is asked to stand with the feet together and the arms at the side, and to close the eyes and hold the position. And normally the client can maintain posture and balance. A positive Romberg is a vestibular neurological sign that is found when a client elicits a close of balance when closing the eyes. And this may occur when cerebral ataxia occur or loss of proprioception or loss of vestibular function. The nurse should determine the client's risk for falling by collecting data. Because the client has difficulty of maintaining balance, the nurse should instruct the client to ask for assistance when getting up or walking. Decreasing the light in environment is done if a client has photophobia, means sensitive to light, and client with a shuffling gait when patient is have a Parkinson disease, right? What next? The nurse learns in report that the client is exhibiting a special sign of respiration, and we call this time stroke respiration. So based on this data, which action the most appropriate for the nurse to take initially? So my patient has a time stroke respiration. On based of this data, what are the most priorities? Listen to the client's heart sound. Determine whether the client has a pulse deficit, or instruct the client to use a spirometer, or determine the client's ability to follow the verbal comments. Definitely, the time stroke respiration, we never choose number 1. It is the heart problem. Number 2 is a pulse deficit, means the difference between the radial and apical pulse. Number 1 and number 2 is not an answer. Determine the client's ability to follow the verbal comments. We chose it because the rationale they said that time stroke respiration or rhythmic respiration with a period of apnea. Apnea means absence respiration, occur when in disorder affect the respiratory center of the bones in central nervous system. So in the brain, there are particular area we call bones, and inside the bones, the respiratory center is there. If the disorder affects the respiratory center in the bones, and patient have this problem, so such as metabolic dysfunction in the cerebral hemisphere or basal ganglia, the nurse should initially obtain data about neurological function. Start with determining the client's ability to respond the verbal stimuli. Means our brain is work, it is not affected. Listening to heart sound is important, but secondary to determine neurological status. There is no information related to the need to check for pulse deficit. Is the difference between apical and radial pulse. And next question here. So the nurse note documentation that a client has conductive hearing loss. The nurse plan are knowing that this kind of hearing loss can caused by which circumstance? So conductive hearing loss occur because of physical obstruction in the transmission of sound wave. Conductive hearing loss most common in acute otitis media. If the inner ear field of the fluid we call effusion or fluid buildup in the middle ear and can blockage of transmission of the sound we call conductive hearing loss. Select all. So a defect in cochlea is not cochlea. If it is defect in the cochlea, it should be sensory. Acute otitis media with effusion, this is the choice. A defect in the 8 cranial nerves. If the cranial nerves or cochlear involvement, it should be sensory neural. A defect in sensory fiber, no. And number 5, physical obstruction, yes, of transmission, because it is conductive hearing loss. Why we choose this answer? What are the rationale? A conductive hearing loss is a result of a physical obstruction to the transmission of sound wave. Acute otitis media with effusion means a fluid buildup in the middle ear or can block the transmission of sound wave. A sensory neural hearing loss occurs as a result of pathological process in the inner ear. A defect in 8 cranial nerves or a defect in sensory fiber can lead to the cerebral cortex problem. And next question here, they said, which one, the question here, while collecting data related to the cardiac systems on a client, the nurse hear a murmur, which best describe the sound, the heart murmur. So murmur is an added sound, abnormal sound. And the normal heart sound is S1 and S2. We call lap dub sound. So it is not an answer. Stretch or leathery heart noise, right? Or it is gentle blowing noise. Murmur basically a very gentle and blowing sound. Abrupt, high pitched snap. It is not a snap. So why we choose blowing sound? A heart murmur is an abnormal heart sound and is described as a gentle blowing, right? And it occurs from increase or abnormal blood flow through the valves of heart. Dub sound are normal and represent S1 is the first heart sound and S2 second heart sound. And second heart sound. A pericardial friction rub is described as a leathery heart sound that occur with pericarditis. A click is described as a abrupt or high-pitched snapping sound.